It is a lovely, lovely good afternoon. Thank you very much for joining me on Lunchtime Chat. We apologize for starting Lunchtime Chat late, but I hope you can still be part of our Lunchtime Chat by sending us a text message or giving us a call on the number appearing on your screen. My name is Zambia. We are live on GoTV channel 27, Top Star channel 102, and of course DSTV on channel 279. Don't forget our social media platforms such as Instagram, Twitter, now X, as well as YouTube, and our Facebook page. This afternoon, we're looking at the importance of health research program, as well as we'll also be looking at the National Health Research Conference that will be coming up. In the studio, I'm not alone. I'm with Miriam Chimba, who is the chairperson of the Coordination and Publicity Sub-Committee National Health Research Conference, which will be hosted by the National Health Research Authority. Good afternoon and welcome to Lunchtime Chat.
Good afternoon, Taisia. I'm well, thank you, and thank you for the very warm welcome.
All right.
Happy to be here.
It's good to have you here. And maybe just a brief overview concerning the same. So the National Health Research Authority, NHRA, is a regulatory body under the Ministry of Health that was established under the Health Research Act number 2 of 2013. The mandate is to provide a regulatory framework for the development, regulation, financing, coordination of health research, and to ensure the development of the consistent health research standards and guidelines for ethically sound health research in Zambia. The functions of the NHRA includes capacity building. Am I right? Yeah, it includes research promotion, research regulation, research coordination, research capacity building, and research dissemination, as well as knowledge translation. And I think I've said much. Maybe if you can just make us understand what this program is all about.
Okay, thank you so much, Taisia. So like you said, the National Health Research Authority is a regulatory body under the Ministry of Health. So it was set up to oversee health research in Zambia to ensure that that research is ethical, that health research is financed, and that health research is properly disseminated. So one of the major goals of the National Health Research Authority is knowledge translation. How do you take complex research, these very scientific facts, figures, and data, and translate it in a format that is usable, that is understandable for decision making in the health sector? And that is primarily one of the goals of the National Health Research Authority, is to ensure that that information is available, it's translatable, it's usable to policymakers and other decision makers that make decisions that impact the health of our communities and the health of our nation.
All right. Now, maybe if you can also just look at the sustainable and resilient health systems and why these concepts are crucial for achieving universal health coverage, especially in the context of Zambia.
Okay, so like I said before, you know, we can really see the importance of health research, and also in terms of universal health coverage. I'll talk about why specifically universal health coverage is important and how that fits into the mandate of the National Health Research Authority, and also why the authority is invested in hosting various forums of discussion around health and health issues. So Zambia in particular is plagued by so many public health issues and public health emergencies. So what the authority is helping to do is to ensure that when we need to make a decision about a public health issue, that we have information I'll give an example of a recent epidemic, the cholera epidemic we had early in the year. So what the authority does is to promote research so that the next time we're making decisions about what interventions we're going to implement to prevent public health emergencies like cholera and COVID-19, that we are coming from a place of facts, that we have data available, we have knowledge that is there about these ongoing health issues that plague our communities, but we also need facts to be able to inform the decisions that we're making. How many people are affected? Where do they live? What has been effective in the past in dealing with public health emergencies? What has been effective in dealing with health issues? What has helped the health of our communities improve in these particular emerging diseases and other public health threats? So you really see that there is a role there, not only for the regulatory body, but there is also a role for research. There's a role for research because it provides us with facts to be able to make decisions about our health and well-being as a nation.
Interesting. Now, what are some of the key service delivery challenges that the health systems in Zambia and similar contexts face, and how are we as a country addressing these issues?
So I'll speak in line with the work of the National Health Research Authority. So there's so much, of course, as a country that we're doing to respond to public health emergencies, but also just to ensure better health for our communities. There's so much that we're doing. But with respect to the National Health Research Authority, one key thing that we're trying to do is to build a knowledge base of what these health issues are.
Interesting.
Who is affected? Can we have real data, real information, and not for that information to just sit on a researcher's table, but to be available to the next decision maker, perhaps in the Ministry of Health, or to a partner or to a donor, to say, no, these are the current needs according to the research that we've done. I'm not sure if I'm on the way to
of course
you're answering
of course, yes,
the question. So one of the key things that the authority is bent on doing is creating opportunities to have discussions around health research. What's new? If I'll give an example. If, for instance, as a health researcher this year, there's an independent researcher somewhere in Zambia, maybe in a university or college, they've worked on something, maybe that shows a new way that we can respond to TB, or a better way of delivering healthcare services in our communities to those that are affected by various diseases. How are we going to know? How are we going to be able to take that knowledge from that independent researcher to be able to use it at a national level to save lives? And that is the gap that the National Health Research Authority is filling. Can we have access to that information? And then can we also present it now to a decision maker in such a way that they're able to apply that information? One of the ways that the authority is doing that is by convening the Zambia Health Research Conference. This is a biannual event. It happens every 2 years. And this year, we're actually having the 11th National Health Research Conference, whose goal is to convene discussions around health research, to try and find out what is new in the field. How can we apply it? How can we not only disseminate the research that is available, remember again, yes, say that independent researcher, yeah, how do we bring them to a place, yes, where they'll be able to talk about the research that they're doing, and more importantly, that research or the findings of that research end up in the right hands of someone who is able to use it to make a decision. And so one of the
in this
key
case,
things,
when you say they're able to make a decision, are you talking about people, especially now the general public? Because in this case, when you conduct a research, probably you need to come up with a solution to that research. What's the solution? And probably the person who's supposed to receive that type of information. Are you doing enough to just ensure that there's sensitization on the ground? Because if you find a research, say, okay, this, we can prevent this by doing this and this, but are you going on the ground as well, apart from just ending on research and then coming up with solutions? Are you going on the ground?
I would say that when we convene at an important forum such as the Health Research Conference that's coming up, we're very specific with who is going to be in that room. It may not necessarily be the direct public, but it's someone who is in charge of the health of the public or who needs that information so that they can make a decision about the health of so many people. So I'll give an example. This year alone, in some of the committees that are working to put this together, there is so many institutions, maybe an estimate of nearly 100 institutions working in the health sector in Zambia. Think about those institutions at every level, whether it's departments in the Ministry of Health, donors, partners, other government agencies. As long as someone has a stake in health, these are the committees, one of which I've had an opportunity to chair. These committees are made up of experts and specialists that are making decisions every day about where medicines are needed the most. I'll give an example. For instance, now that we're facing this drought, for instance, and if there's been research in that regard, what the Health Research Conference does is to be able to create a platform to bring that research to the fore, and that can we make it available so that someone who is sitting, for instance, at the Ministry of Health, maybe in the maternal health department, can look into that research and say, you know what, according to these findings, perhaps we should go in this direction. I like what you said about, is it research providing a solution? Yes. I think that that's a question for the ages, because it's a very interesting question, because I think that the goal of research isn't always to provide a solution. Sometimes it's just to shed light on what's going on the ground. But I'm pretty sure you know that when you do any kind of research, you have an opportunity to recommend actions based on facts and not just imagination. I'll give an example. If you go, for instance, to Chongwe district and find that it's one of the hardest hit communities by the drought that we've had this year, and as a result, it's going to affect children, and there might be cases of malnutrition, child stunting. So if you do your research and it shows that actually the ones that the area that needs this intervention the most is Chongwe. But in that Chongwe, the people that need the intervention the most are children. And among those children, maybe the ones that actually need that intervention the most are children from 1 to 5 years. And this is what we found when we went on the ground, according to evidence. So based off of what you found in your research, I think that you are very well placed to give a recommendation on the next course of action. So because of what this research has shown, can we have such and such an intervention? And I feel like, in essence, that's what research helps to do, is shed light. But one of the reasons that that the authority is also invested in platforms like the Health Research Conference is so that those recommendations can have their day in the sun. Okay. Because without the active work of putting out that research, disseminating it, allowing decision makers to see it, you risk a very good recommendation, a very good intervention sitting on a table gathering dust. It's a great academic paper, but how do we take it from where it is to make it operational in in a real life sense to improve the health of people.
Now, looking at the conference that is that will be coming up, do you think you're probably going to address the impact of emerging diseases and pandemics on the health systems? Do you think it's really going to give that impact on some of the diseases that might just emerge?
Yes. I'm very interested in that question because I think one of the areas of that I'm really passionate about, and I think it's been the focus of the global health community, is emerging diseases and pandemics. I think after the COVID-19 pandemic, we were all taken aback by how something that you could not see coming can have the ability to impact the lives of so many people.
Because a number of them even lost jobs.
Yes.
Yeah, companies closed down. So if we're going to look at some of these probably emerging diseases and pandemics, I think we should really look at the impact of the conference that we're going to have. What is it that we expect to probably also achieve out of this conference, and what impact it's going to have on just the same diseases as well as just the citizens, because they're the ones that get to feel the impact.
Thanks for that question. This year, the theme is actually set, the theme of the conference is set to try and find solutions as a nation on how we can be better prepared to deliver health services, even in the face of emerging diseases, even in the face of pandemics. How can we ensure that even if a pandemic emerges today or there's an outbreak, that our health systems are fully prepared to take on both the load of that threat coming from the outside, from the emerging disease, and still be able to continue providing basic health services for a prolonged period of time. How do we avoid interruptions? Just like you said, many people, there was a lot of service interruption during the COVID-19 pandemic, but you also saw that our health systems were really tested. They were really tested, and some weaknesses and also strengths were revealed in how we handled the pandemic. So one of the goals of the conference this year is to try and look back at what have we learned from our health systems in the face of pandemics. How can we apply that knowledge going forward, also from a research perspective? Perhaps let me take a moment to just go over what the theme is for the conference this year and what specific areas the conference is going to address to bring impact to the community, like you said. Let me just look back at my notes. And so the theme for this year is sustainable and resilient health systems. So we're trying to find a way to think around how can we accelerate progress towards universal health coverage in the face of these emerging diseases, in the face of these pandemics and diseases. And so you can see that this theme is around responding to public health emergencies. So you will see research presented at the conference in line with the theme. Any research that has been done, actually allow me to speak to the, we recently closed off receiving summaries of research that has been done in line with this year's theme. And we've received so many papers with so many recommendations. But those great recommendations based on facts and information that has been researched from the ground. We don't just want it to take a back seat. We have a team of experts on a national level that is looking into those papers to try and bring the very best of recommendations to the fore. And so what we expect to see in terms of universal health coverage and responding to public health emergencies are innovative ideas coming from the nation of Zambia that will impact the way we deliver health services. And so, well, throughout this period, those papers have been assessed, and the very best that will be selected and presented at that conference. So why is it important that they will be presented, and how does that impact communities? Like I said before, when they're presented with recommendations based on facts. And the conference attracts researchers, academicians, policymakers. There is people in that room that needs to know that information, and those recommendations and bright and innovative ideas from some of our best researchers in the country are presented there, so that not only the public can access them, but also the one who sits in that office to make decisions about the health of the people, so that they can have facts to back up those decisions.
Let's allow a call.
Okay.
You're through to Lunchtime Chat. Good afternoon.
Good afternoon. I'm speaking with.
This is KBN TV. You through. This is Lunchtime Chat on KBN TV.
Sorry, I think.
So this is a Lunchtime Chat, and if you want to call us, ensure that you check what's on the screen so that you can probably have enough information and know what to probably comment on. Always ensure that you adjust the volume on your TV set. This afternoon, we're looking at the importance of health research. Of course, not forgetting that there's a conference that is also coming up, and that conference will be hosted by the National Health Research Authority. So make sure to send us a text message on what you think, why it's important, just to probably have a clear understanding or research on health. And then how can policy development and innovative solutions contribute to building more resilient health systems?
Through research, like I said, the policies have to come from somewhere. And what we're hoping to do, even with the conference, is create a knowledge base on which we make policies. Policies are just the will or decisions that are being expressed, isn't it, in a document? It's a direction, a guideline on how to handle an issue, or how to handle issues in the health sector. So when we're looking at health policy, how do we bring innovation to that space? I think the solution is prioritizing health research, the dissemination of health research. I'm sure you agree with me that it's like a saying it's like a saying, say, oh, Zambians are very good at talking. They're very good at writing papers, but come to implementation. And so we're trying to change that narrative.
Because I'm sure people out there are still saying they're very good at coming up with research, but when it comes to giving us answers to how we can even just prevent certain diseases, or if a pandemic, probably we'll find ourselves in that pandemic, how do we get to handle such situations? So I think that's where we get that from, because we're like, but when it comes to just making sure that we probably find solutions and answers to this, it doesn't really work.
And that's been owed to, it's been owed mainly to not prioritizing research. I will tell you that across universities in this country, every year, you can imagine the level of innovation and creativity that our scholars and even other research institutions put into going on the ground, talking to people. And as a nation, it's good for us to turn our attention towards making decisions not from thin air. How are you going to decide what health intervention goes where if you don't even know the facts? You don't have the data. How are you making that decision? How are you arriving at those decisions? So we see why it's important to disseminate health research and how it should inform the decisions we make about our health system.
All right. Then maybe as we conclude, what opportunities are there for health professionals, policymakers, and researchers to collaborate and learn from each other to improve health systems as we conclude?
Sorry, please help me with the question.
All right, so the question is, what opportunities are there for health professionals, policymakers, and researchers to collaborate and learn from each other to improve health systems? So what opportunities are there?
Okay, I'm going to speak to the conference. Yes. So if you're an institution, an individual, an organization that has a stake in the health system in Zambia, I would highly recommend finding out more about the conference and putting yourself in that space where you can meet other people that are working on some of the same things that you're working on. I can promise you that it will be an interesting time to sit with some of the quality research that has been done in this country, and to find out how can we take those recommendations and implement them in our work. I think that research institutions would benefit a lot from convenings such as the Health Research Conference. Donors looking to make decisions about funding areas and priorities have a stake in a convening like the conference. Individuals, individual researchers, independent researchers have a stake in ensuring that they can come there and have an opportunity to network. And more importantly, we are actually scheduled to have some very impactful keynote speakers that will present a voice, not just for the nation of Zambia, for the region, the Africa region, the Southern and East Africa region. I hope that you invite me back for another chat where we can talk about who these key thought leaders are in the global health space, and that how
maybe just if you can just probably mention one or two. Yeah.
Well, no, and not to give away too much, but perhaps I can talk from a regional perspective. We have amazing men and women who are Zambian, who are working from a regional level in pandemic preparedness and emerging diseases, and they're doing such an amazing job. I will not give the names for now per se, but just know that we will have one of our representatives who is currently doing such a great job and flying the flag high in terms of health system strengthening for the nation of Zambia. I won't say the names, but we might also have a regional representative from the East Africa region just to come and share best practices. I think that's one other thing I forgot to mention is that the direct benefit of this convening is to be able to share best practices in research, in health research particularly.
Okay. When is the date for the same conference?
It's taking place between the 15th and the 17th of October. So there's plenty time to be able to prepare to be there. So that's 15th to 17th October this year. I think we have about 80 something days before the conference, and more information about that can be found at the Zambia Health Research Conference website. So if you just put in your search engine the Zambia Health Research Conference, the site will come up, and all the information you need to see, including some of the abstracts that have been submitted already for review and presentation. Some of them are listed there, but the Health Research Conference website is such a huge resource because even what has been done in the past is still there. This is the 11th, so it's a series. This has been happening for a very long time, and we hope that we can gain a bit more publicity regarding the important work that has been taking place over the years.
All right. Thank you very much for making an appearance on Lunchtime Chat.
Thank you so much, Taiza.
All right. That was Miriam Chisha Chimba, the chairperson of the Coordination and Publicity Sub-Committee, National Health Research Conference, which will be hosted by the National Health Research Authority. This afternoon, we're looking at the importance of research in health, as well as the conference that is coming up. This will be the 11th conference, if I'm not mistaken. This is the 11th series, right?
Yes, it's been a series,
yeah.
So it happens every 2 years. So this is the 11th Health Research Conference. So after this, it's a biannual conference. After this year, it will come again after 2 years. So it's good to take advantage of the opportunity to be present this year.
All right. Well, we've come to the end of our lunchtime chat. We'll see you tomorrow, same place, same time. For me, Taizia Cheles, bye-bye, and continue watching KBN TV, the finest television. Have a lovely afternoon.
you.